Welcome to this installment of the Community EMR instructional videos Medical History Band Overview. This video was developed by the WRHA CSIS team in coordination with EMR users. This video is meant as reference material regarding the functionality of the EMR. Examples provided during the demonstration cover various workflows and should not replace any on-the-job instruction provided by on-site supervisors, managers, or directors. The following topics will be covered during this session: defining the medical history, brief description of the surgical medical history, lifestyle history, family history, social history. The process of adding, modifying, and deleting within these bands is the same. To reduce the repetitiveness of this video, we will only demonstrate the processes within the surgical medical history and the lifestyle band. We do, however, recommend that you practice the scenarios in all three bands. The medical history bands are found in the EMR section of Acuro within the Encounter Note tab on the right side of the screen. They capture the patient's current state as a snapshot in time of medical history and medications. This video will focus on the surgical medical history band, lifestyle band, family history band, and social history band. Other videos have been created with detailed information for active medications, allergies, and other medical history bands. You may notice quite quickly that your bands may not appear in the same order as other users. The configuration of this information is user-specific. Depending on your role and how you use this information, you may choose to customize the display of medical history bands to your liking through the Acuro target and user preferences. The surgical medical history band is a list of episodic issues that are unlikely to recur. This band is arranged by subcategories. There are 9 main categories, and under each section is a drop-down list of 6 to 8 specific conditions. It should be noted that the drop-down list for class and/or details do not require an entry in order to enter a note and save it. To add a history, click on the green plus sign to open the history selection window. Select the desired history from the predetermined list. As mentioned, each category of histories have layers within them pertaining to that particular entry. For example, if you wanted to add acne as an episodic history, you would first need to select dermatology as the broad category with further refinement of acne. Click on the down arrow to identify the class if appropriate, noting that this will only help you visually. If desired, click on the down arrow beside the details field to select the desired descriptor to the history selection. In this example, I will select acne. If desired, type in the note field to further describe the situation. If known, select the date of the surgery or presenting situation. The lifestyle field allows one to select a response from the drop-down at what stage of the life cycle did the history occur. Now you are ready to do one of the following. Click on Save and New to save current entry and add another one, or click on Save and Close to save current entry and exit the history selection window. Your newly added entries will be visible under the medical history band. You will now notice that under the surgical medical history band, the description will appear bolded and italicized beside the type of history. The lifestyle band is used to identify patients' lifestyle scenarios that may or have impacted their health. For example, smoking, exercise, etc. If a patient has information entered in the lifestyle record, they are visible in 2 places of the patient's chart. First, within the medical history bands, under the lifestyle band, and secondly, under the EMR section within the medical history tab. This patient, Andrew Armstrong, has information entered within his lifestyle band indicating substance abuse. Let's look at the Medical History tab and locate where this information can be found. You will notice that this screen is divided into 3 fields, and at the bottom left side, the Lifestyle History field is present. Returning to the Encounter Notes tab where the medical bands are found, I will review how to enter a lifestyle record within the lifestyle band. To add a lifestyle record, click on the green plus sign icon right next to the title of the band. This will open the lifestyle window. Select the desired lifestyle from the predetermined list by using the arrows either up or down and highlighting the section. For this example, I will add tobacco and select Current User. Click on the down arrow beside the Details field to select the desired descriptor to the lifestyle. I will enter cigarettes. If desired, type in a note to further describe the lifestyle. I will note 10 to 15 daily within this section. Both of these descriptors will be displayed in bold and italicized font beside the lifestyle entry. Lastly, do one of the following. Click on Save and New to save current entry and add another one. Or click on Save and Close to save current entry and exit the History selection window. Your newly added entries will be visible under the Lifestyle band. The Family History band is used to identify patients' family history of diagnoses and/or disease states that may or have impacted the patient's health due to the genetic relationship. For example, a form of cancer and whether there is a family history of that particular form of cancer, which may identify a predisposition to it based on genetics. If a patient has records already entered or once the family history record is entered, the records are visible in 2 places of the patient's chart, like the lifestyle history and the history of problems band. 1. Under the family history band, which is under the medical history band in the EMR, and 2. Under the EMR section under the medical history tab. The screen is divided into 3 fields, and at the bottom right side, the family history field is present. The social history band is a list of the patient's presenting circumstances within the social realm. Again, the social history band processes are the same as entering information within the lifestyle band and the family history band. As such, for the sake of time, this video will not repeat the process for adding, editing, and deleting an entry. If a history has been entered in error or requires additional information, we do have the ability to modify and/or delete entries as necessary. This is done by locating and selecting the history you would like to modify and double-clicking. I will select the dermatology example I just entered. Once you double-click, the surgical medical history window will appear. You will notice this contains the same information as when a new history is being added. Go ahead and modify the information as required. Select Save and Close, or if you are seeking to delete this information, select Delete. A Remove History window will appear, and it will prompt you to confirm yes or no whether you want to remove the item from the patient's record. Click Yes, and the item is now removed and deleted from the patient's band and file. Once completed, you click on Save and Close. You have now modified the history. When deleting the patient's history item, you must be aware that once deleted, it is permanently removed from the patient's chart and there is no longer a record of that history. Documentation within these bands is limited to adding any external medications you may find within your consultation with your patients. This information is helpful to other service providers as it is a listing of medications prescribed outside of the provider's clinic. For example, your patient discloses that they are taking Tylenol on a regular basis for pain management. This information can be added to the EMR. Select the green plus icon. 2 external boxes will open. Begin by completing the top box. In this case, I will type in Tylenol and select the magnifying glass to search. A myriad of options will list. Select the appropriate medication. In this case, I will select Tylenol 500 mg caplet. Hit Select. This will close the top box and provide full view of the second box. Details of the external medication can be added in this section. You can update the provider if known. You can also add free text under the note column by double-clicking on the blue area. I will enter the amount and frequency this patient is taking the Tylenol, 1 cap daily. Select Add. You will notice the external medication is now listed under the band. We hope you have found this presentation of the Accuro History of Problems Medical History Band helpful. For further questions or clarifications, please contact csis_support@wrha.mb.ca.